So, Dr. Raman, tell me about the research you guys are doing, and tell me what the goal of this research is and why it's important to FA.
Sure. Well, we know that one of the leading problems in patients with FA is that they develop heart disease, and it can also be termed cardiomyopathy or heart muscle disease. And because of the genetic nature of the condition, it's almost like the heart may be programmed to develop dysfunction at some point. So what our research is focused on is to really be as proactive as possible in picking up the earliest changes that we can find in the heart at a point where it's treatable. You know, we all too often come across individuals with FA who've developed congestive heart failure and a very thick heart or dilated heart that's not functioning properly. And at that point there may be a lot of scarring of the heart muscle, making it difficult to reverse that process. But by looking at individuals who have not yet developed symptoms of heart failure or arrhythmias, we found some subtle changes that can be treated at a stage where we think not only prevent symptoms of heart failure, but prevent arrhythmias and prevent worse outcomes due to heart disease.
All right, so how are you guys doing that exactly?
So it's a combination of things. The first is talking to the individual, asking them about any symptoms that they've had related to their heart, like palpitations, swelling in the legs, difficulty breathing. Most individuals who haven't had prior heart problems don't have symptoms like that. So then we need to do other types of tests, and we do an electrocardiogram. And the EKG is often subtly abnormal, but it's what we call nonspecific. So it doesn't tell us really a lot of specific information about the state of the heart muscle. The most refined way that we have right now looking at the heart non-invasively is something called an MRI of the heart. And the appeal here is that we can get really exquisite detail of the state of the heart muscle, the blood supply of the heart muscle, the function and the structure, all completely non-invasively, and to some extent with better information even than what you might get by taking a piece of the tissue, with a biopsy and looking at it under the microscope. And an MRI is, if anybody's had one before, it's kind of a loud machine, kind of a cozy space, and it's not the biggest place to be swimming around in. But the appeal is that it doesn't involve really any radiation. It's completely non-invasive and gives us so much detail. And by doing this in a group of individuals with FA who participated in this study, we've learned a tremendous amount. And we found that, for example, individuals who may have chest pain, this may be related to what we call microvascular disease. That is, the main arteries supplying the heart are fine, but the small branches within the muscle don't have the energy to dilate when the heart needs more blood supply. And that links with the underlying mitochondrial disorder. And so finding the microvascular disease, again, gives us a target for treatment. In cardiology we have a lot of good medicines that are already available that can treat that. And then we also carefully measure the thickness of the heart, because if it's abnormally thickened, again, that's something where we might be able to treat it and prevent progression of heart muscle disease. And then in addition to the MRI, we're doing some blood tests that look at things like cholesterol levels, blood sugar. We know that maybe around 10% of individuals with FA develop frank diabetes, but even short of that, there are other features of what we call metabolic syndrome, meaning the cholesterol may be high, the triglycerides in particular may be high, and we know that all of those have a very close relationship with the working of the blood vessels. So maybe the abnormal cholesterol levels, if treated, can improve the microvascular disease and prevent progression of heart disease. And then we're always thinking about what can we do today, because research is sometimes something that takes many years to find out new solutions. And part of what keeps me going is I see individuals with FA, and I'm always thinking about what are the options on the shelf, so to speak. And I think in talking with my colleagues who are involved in this field as well, I think we all agree that potentially eating a heart-healthy diet is a good thing. avoiding saturated fat and eating lots of whole grains and fruits and vegetables, certainly not going to hurt you, and it may be a good thing as well from a cholesterol and diabetes standpoint. And then exercise may also be another thing that helps FA. And I've met some remarkable individuals such as you, Kyle, who have a tremendous exercise ethic and regimen, and it may be that that's part of the success of staying healthy over time. We certainly know that when I mentioned metabolic syndrome earlier, one of the treatments that we use in individuals with that condition is advocating healthy diet and exercise. So it's possible that those things may be beneficial in FA as well.
In anything that FARA has helped you out with, how has it pushed your research forward?
FARA's been tremendous. We wouldn't be at this point where we've learned so much about these early changes in the heart, about these metabolic changes, without FARA's support. So thanks to Ride Ataxia and thanks to the Kyle Bryant Transitional Research Award, we got our first grant a few years ago that really funded this study, that made it possible. And without that, it would have been impossible to do. And that now gives us the important findings to go out and seek even more support from other sources, because as many questions as we try to answer, sometimes we generate more questions and we realize how much we don't know when we find out something that we do know.
So talk a little bit about the collaboration with Dr. Payne and Dr. Lynch and how that's helping to move things forward.
Right. And we always kind of have our sights on two aspects. One is what can we do better today, and two is what can we do better tomorrow. And what we can do better today is part of what I'm working on with Dr. Payne, which is defining what is sort of the standard of care, what are the standard evaluations that should be done for individuals with FA in terms of, for example, periodic electrocardiograms, maybe an echocardiogram or other testing to help pick up early changes of heart disease at a stage when it's treatable. And we're putting together a document in coordination with the National Institute of Neurologic Disorders, or NINDS, and FARA to help that kind of disseminate out into the community of physicians, so they'll have access to the latest information on what the standard of care should be today. In terms of what we can do better tomorrow, that's where research is so important, and that's where working with Dr. Lynch and the CCRN FA network helps us come up with the right questions to ask, design the most efficient studies to come up with the right answers in the most expedient, cost-effective way, and then translate those research findings into better care.